Hey everybody, thanks for watching our presentation. So for mine and Jomi's project, we examined DRA intervention on noncompliant behavior in school children.
So what is noncompliance, and why is it important? Noncompliance is a problem behavior commonly seen in children with or without developmental disabilities. Noncompliance originally establishes autonomy when a child is younger, but when they become older, it can become a big problem if a child refuses to listen to anything a parent or caretaker says. Noncompliance is often used as a way to escape demands placed on a child, and parents accidentally reinforce noncompliance when they remove or forget about the request they gave their child. This often spills over into classrooms and is a common problem for teachers. This often causes disruptions to the children learning and potentially can escalate into aggression. Research shows that higher compliance is highly correlated with academic engagement, meaning that if children are complying with their teachers, they're more likely to learn.
Differential reinforcement of alternative behavior, or DRA, is defined as a schedule of reinforcement in which reinforcement is delivered for a behavior that serves as a desirable alternative to the behavior targeted for reduction and withheld following instances of the problem behavior. There have been several studies that have looked at the effects of DRA. Previous studies have found DRA to be a useful treatment for many problem behaviors. Some previous studies have also found that compared to extinction alone procedures, DRA resulted in fewer negative side effects and also resulted in more rapid reduction of behavior. Our study had 3 participants, Jordan, Teresa, and Lee. Jordan was an 11-year-old male who had been diagnosed with ADHD. He had no other disabilities and took no medication for his ADHD. Teresa was a typically developed 10-year-old female who had been diagnosed with oppositional defiant disorder. And Lee was a typically developed 11-year-old male. And all of the participants displayed a high frequency of noncompliance behavior. The study was conducted at a Southern Illinois elementary school. All the participants attended the same school but were in separate classrooms. All sessions in the study were conducted in the participants' classrooms and were conducted in a randomized order between the times of 1 and 2 p.m. In our study, the independent variable was the DRA schedule. Our dependent variables were noncompliance and compliant behavior. In this case, noncompliant behavior was put on extinction and compliant behavior was reinforced. The researchers operationally defined noncompliant behavior as when issued a specific verbal discriminative stimulus, the participant exhibited a behavior other than that specified. Inter-observer agreement was conducted for 40% of the sessions using video recordings. IOA was calculated using the block-by-block method and resulted in 90% or above for all of the participants. A functional analysis was conducted for all of the participants. The conditions of the functional analysis were play, alone, attention, and escape. An AB-AB design was used to analyze the effects of treatment on noncompliant behavior. Each session in the design lasted 15 minutes and consisted of 5 3-minute intervals each. All sessions were conducted at the same time of day in the same classrooms. So for our procedure, before we implemented any intervention, we conducted a functional analysis to identify what was maintaining the noncompliant behavior. As mentioned before, the conditions in the functional analysis were play, alone, attention, and escape. In the attention condition of the functional analysis, the participant received 5 seconds of attention contingent on noncompliant behavior. In the play condition of the functional analysis, the participant was given free access to highly preferred items. During the escape condition of the functional analysis, the participant was presented specific tasks to be completed. The tasks were promptly moved for 1 minute contingent on noncompliant behavior. During the alone condition of the functional analysis, the participant was placed into an empty classroom void of any external stimulation to examine if the behavior was maintained by self-stimulation. All sessions of the functional analysis lasted for approximately 15 minutes. For each session, the frequency of the target behavior was observed and recorded by the experimenters. The baseline condition of our study was similar to the escape condition of the functional analysis. During baseline, non-compliant behavior resulted in the removal of a task for a 1-minute period. Researchers measured the frequency of non-compliant behavior until steady state responding was achieved. Once steady state responding was achieved, the intervention was implemented. During the intervention, DRA was used. This consisted of reinforcing compliant behavior and putting non-compliant behavior on extinction. If non-compliant behavior was exhibited by the participant at any time, the child was immediately prompted to complete the task and was not allowed to escape from the work. If compliant behavior was exhibited by the participant, a reinforcer in the form of a highly preferred food item was given. Jordan's highly preferred food item was gummy bears, Teresa's was Reese's Cups, and Lee's were Starbursts. During the initial intervention, reinforcement was delivered on a continuous schedule of reinforcement in order to establish high, steady rates of responding. During the second intervention phase, the schedule was thinned to a variable ratio of 3 in order to maintain a constant high rate of responding.
Social validity was assessed through a survey given to teachers and parents of each participant. A Likert scale from 1 to 5 was used to respond to questions such as, do you believe the treatment strategy helped the participant become more compliant, among others. Here is an example of the results we found from conducting our functional analysis on our participants. Out of all 4 conditions, it is easy to see that escape was the condition that maintained the non-compliant behavior. It is also inferred that the escape was due to demands placed in the classroom. The results we see here in Lee's bar graph was also replicated in Teresa and Jordan's functional analysis. It makes sense that the escape condition had the most non-compliant behavior because in the play and alone conditions, the opportunities to engage in non-compliant behavior simply wasn't present. There was a couple of instances of non-compliant behavior during the attention phase, but it wasn't enough compared to the escape condition. All right, as you can see here in our graph of Teresa's non-compliant behavior, she displayed a very high frequency of non-compliant behavior during the baseline condition where we replicated the escape condition from the functional analysis. And you can see that when the intervention was applied, that the non-compliant behavior dropped drastically. Steady state responding was established in both conditions, and the return to baseline condition shows a marked increase in non-compliant behavior. Once the reinforcement was removed of the compliant behavior, the non-compliant behavior just came back. And we reintroduced the intervention, but on a thinner schedule of reinforcement with a VR of 3. And thankfully, the non-compliant behavior returned to a much lower level, showing the effectiveness of the treatment and the treatment alone. Though their graphs aren't shown, Jordan and Lee also demonstrated this pattern of behavior when the intervention was put into effect on their non-compliant behavior. They also started off with very high levels of non-compliant behavior during the baseline when the escape was reinforced, but showed a large reduction in non-compliant behavior when the intervention was applied to them. So as seen in the earlier graph, featuring the functional analysis of Lee, we could see that the non-compliant behavior was used primarily to escape, and possibly to escape from classroom tasks that the teacher presented to them. We also found that the DRA intervention was effective in reducing non-compliant behavior, and at the same time simultaneously increased compliant behavior. This is one of the advantages of the DRA intervention that we mentioned earlier. We were able to put the non-compliant behavior on extinction. At the same time, we were able to reinforce an alternate behavior. Also, because we used an AB-AB design, we were able to demonstrate the effectiveness of the DRA intervention on non-compliant behavior with a return to baseline phase. These results were able to expand on previous research that demonstrated the effectiveness of DRA interventions on children with disabilities by extending that to children who are typically developed. We were also able to replicate a previous study by Vollmer that showed that high treatment integrity led to higher effectiveness of DRA interventions. By successfully applying this intervention in the classroom, we also further expanded on previous research that this intervention could be useful in classroom settings. As thorough and successful as our study was, there were, however, in fact, several limitations that could limit the external validity of our study. Our first limitation was the broad definition of non-compliance. As you may remember, non-compliance was the response to any request given by the investigator that did not coincide with the fulfillment of said request. Because of the broadness of the definition of non-compliance, behaviors that do not directly comply with a request, such as a sneezing fit, though not truly a demonstration of non-compliance, would be counted as one due to the technical definition and the broadness of our operational definition of non-compliance. Another possible confound was the way we implemented our intervention by having a researcher give one-on-one attention to the participant versus having a teacher integrate their treatment into daily classroom activities. This may make generalizing the intervention into a classroom setting where the teacher has to divide his or her attention among many students difficult. Also, the novelty of having a researcher in the classroom may have affected the behavior of the participants. Another big limitation was that the reinforcers used for compliant behavior in our current study were all edibles. Edibles have been shown to be very salient reinforcers. However, they're difficult to maintain in a real setting unless, there is a lot of one-on-one attention. And in a classroom setting, it may be very difficult for a teacher to implement that kind of reinforcement schedule. It would have been more realistic to have social praise or a secondary reinforcer used instead of edibles, since those would apply much easier to a classroom setting. There is also the possibility of satiation when using edibles as a reinforcer. Lastly, the only compliant behavior demonstrated in the current study was compliance in regard to completing classwork, which is a very good thing when we're trying to work with students in a classroom, but it may be difficult to generalize that behavior to just general teacher commands like stand up, sit down, let's go this way, put that down, that kind of thing. Future research should take these limitations into account when planning on expanding on further studies on non-compliant behavior and DRA schedules of reinforcement. Thank you for listening. Have a great day.